Hello, my name is Dr. Appel from Ado Psychology Center, where we specialize in treating anxiety, depression, and OCD. Welcome to our video seminar series. Hope you enjoy this video. This video is on religious OCD among Orthodox Jews. I recommend you check out our general OCD video seminar if you haven't yet to get the basic understanding of obsessive-compulsive disorder more broadly, and then you can jump into this specific subtype. The goals for this video are for you to understand the nuances of religious OCD, scrupulosity, and how this subtype may be a little bit different than some of the other subtypes, and to learn about treatment, how it specifically applies to this subtype. It's a very brief introduction, and again, you can check out the more general video I did in OCD to learn more about OCD broadly before jumping into the subtype. But as a brief introduction, we spoke about in the other video the OCD cycle and how oftentimes there's a trigger which leads to obsessions. And so for religious OCD, the trigger might be like praying, or it might be being at a grocery store and getting change and wanting to make sure that you're getting the correct change and you're not stealing, right? So it really could be anything causing these obsessions of like, am I a bad person? Did I steal? Am I going to go to hell for this? And so the person engages then in compulsions, such as, counting the change at the store again and again to make sure they didn't get too much money, or when they're praying, repeat the prayer again and again, or step out of the synagogue or main sanctuary and like pray somewhere else where they're less distracted. These are all very common, compulsions, which we'll talk more about soon, which provides relief in the moment, but long term, these are not solutions. And OCD can, get worse without it being treated. And so that's what this video is all about, to get into the nuances of how to deal with this specific subtype. Scrupulosity. When OCD meets religion, right? So religious OCD or scrupulosity is a form of OCD where the obsessions and compulsions are centered around religious beliefs and rituals. Religion itself does not lead to OCD. However, those who are religious and have OCD will likely experience scrupulosity. All right, so that's a very good framework to think about this. It's not that the religion is causing the OCD, it's just the person has OCD, and OCD tends to attack what people value most. And for religious individuals, it often is their religion. And so it often, affects people in their religious belief, religious practices. And of course, as you can imagine, OCD is very distressing as it is, especially when it comes to something so personal as someone's religious belief and practice, which oftentimes is like the highlight of someone's life or the main component of their life even, and OCD can really steal that away from people. It's interesting to note that even among a general population of individuals who suffer from obsessive compulsive disorder, the frequency of religious obsessions are not uncommon. 26% of individuals suffering from OCD endorsed religious obsessions as part of their OCD content. Unfortunately, though, although it's not so uncommon, physicians tend to misidentify this subtype at a staggering rate of 38%. So approximately 40% of physicians, which are often the first line of treatment, don't recognize this, subtype as OCD, and I assume they just attribute it to general religious practice. Even more concerning is that mental health professionals, and this study done by Glazer and others in 2013, looked at mental health professionals from the APA, American Psychological Association, and found that close to a third of them misidentified religious obsessions. So here's a list of common Jewish examples, and on the next few slides, I'm going to be discussing them in a little bit more detail so that you get a good picture of this flavor of OCD. Prayer, right? When it comes to prayer, there can be many types of obsessions and compulsions, such as, did I pronounce the word correctly? Did I have proper intent as I was saying the words? Did I pay attention to what I was saying? Did I have improper thoughts while I was praying? And so these are all very common obsessions, and compulsions could be repeating the prayer until I'm sure I pronounced the word correctly, or going to an area where I'm not going to be disturbed so that I can concentrate, or trying to redo prayer or rethink improper thoughts and make them more proper so that the prayer is not contaminated in some kind of way. As you can imagine, another one related to prayer is actually kind of making sure your body is clean during prayer. So if you need the restroom, using the restroom, not praying while you need the restroom. And so sometimes you can see individuals who are going to the restroom like throughout the prayer again and again and again, to make sure that they are 100% clean and ready, for prayer. So these are some very common examples when it comes to prayer. Another example would be Passover cleaning. So these images are probably a bit of an exaggeration where they're covering everything with silver foil. For those who are not familiar, during Pesach or Passover, we clean our houses out from like any sort of breadcrumbs or things of that nature. And so this is obviously an excessive amount of cleaning out and making sure that your house is properly, ritualistically clean for Passover. That being said, silver foil often is used in many homes, like in the kitchen or on the counter. So it's really important to understand the nuances of the religion and not, classifying everything as OCD, but also being able to recognize it when it is. Sukkot or Sukkot is where we, take the Arba Minim, the four species, and there are different rules as to what they're supposed to look like and what blemishes are considered good or no good. And so again, what's really important to point out is that, for example, the three people in these images here likely do not have OCD, right? And so in many, especially ultra-Orthodox communities, a lot of time, a lot of money is spent on picking out the perfect items. And so that being said, someone with OCD, right, might be doing this also, but not because they are excited about it, but because they're tortured by the ideas of what if this is not the right one. And so this is another example of where understanding the culture is really important. Another example is not mixing milk and meat. And so, right, we're not allowed to eat milk and meat together or cook it together. And so many Jewish homes have like separate sinks for dairy and for meat. But this can become very excessive as well, where someone, is not willing to share a refrigerator shelf even with milk or meat. Or that could also be within religious norms, but maybe it's something like, um, as even if it's in the same fridge at all, right? Like maybe milk somehow spilled out of the bottle and got into the pot. And so again, when it's within the cultural norms, it's not OCD. But when it's very excessive and outside the cultural norms and causing a lot of pain, discomfort, and a lot of what ifs and maybes, then you're probably looking at OCD. Ritualistic hand washing, right? So we actually have very specific ways of doing this in an ideal format, right? You would take it with, one hand, you would pass it over to the other hand, then you would wash each hand 3 times, but not the same hand 3 times in a row. So there are a lot of rules, but someone with OCD, with scrupulosity, might be going through this repetition numerous times until they feel like it's perfectly done, making sure that water got on every single part of their hand again and again and again. And it may be, some might even have this idea of needing to have pure thoughts as they're washing their hands. So this is another example of a common trigger for people with scrupulosity. Mikvah, or like a spiritual bath, where men, especially women, go to the mikvah to become spiritually clean, and there are rules with how you have to clean your body before you enter the mikvah. And so many times people spend, it could be culturally appropriate to spend even 30 minutes or an hour preparing yourself, but not like many hours, right? And not lots of questions after the fact. Was this mikvah, immersion that I did, was it proper? Do I need to redo it? And so this is another very unfortunate area of Jewish life that can be plagued by OCD. Restroom use I mentioned before with regards to being clean during prayer, really being clean in general. Some people with OCD might be going to the bathroom numerous times a day just to make sure that their bodies are 100% clean. Taboo thoughts or images, so inappropriate thoughts. So, if you're not supposed to have certain thoughts, certain like negative thoughts about God or impure thoughts, in other kind of areas, then once again, we're human, we're likely going to have them. And the more you're afraid of having a certain thought, the more likely it's going to pop up. And yet, someone with OCD can't get over that and will constantly be trying to replace bad images with good images or bad thoughts with good thoughts. So that's another common example. Sabbath observance, right? So when it comes to keeping Shabbos or observing Sabbath, there are plenty of laws and rules, and all this is like beautiful within the culture, and yet it could become torturous for someone with OCD. Monetary laws, getting the right change from a store, using Wi-Fi where maybe it wasn't your Wi-Fi, didn't get permission, right? I'm not condoning this, but I'm sure many people have done it before. But someone with OCD might try to track down the house of where the Wi-Fi came from and try paying them for it. Or, asking the cashier to recount the change or going back to the store to make sure that they didn't get too much change so that they're not stealing from the store. So these are other examples. Some of these don't apply specifically to Orthodox Jews, obviously, such as the previous one, but others do. Do I truly believe? It's a very common OCD theme, which is how do I know for sure? And the answer is you don't, right? Usually that's the answer. It's called faith for a reason. And yet, we're not really bothered by this for the most part. Someone with OCD might not be able to get this thought out of their minds. How do I know for sure, for sure, for sure? Maybe I don't really believe. Maybe I'm just doing this because I have to. Sometimes people, rethink their lives and they want to check in with themselves and check in with their thoughts, which is, again, part of the human experience. Well, when it comes to OCD, you know, they can tell you, like, yeah, I believe. But when I'm triggered, I start freaking out about it. So that's another example as it relates to scrupulosity, religious OCD. So these are many examples. Hopefully you got some interesting, flavors of what it could look like. And now let's talk about OCD versus standard religious practice. So how do you differentiate what's considered excessive and extreme and OCD like versus standard religious practice that is common within one's culture? So there was an interesting study done by Rossman, Pertinsky, and Sieve in 2010, looking at Orthodox versus non-Orthodox Jews. And the hypothesis of this study was that Orthodox Jews would be less likely to recognize scrupulosity or OCD and to recommend treatment because of the value they place on careful adherence to religious laws. So the idea was if you asked a religious person, is this OCD? They'd be like, no, this is great, stringent religious practice. Like, I wish I could be as good at the religion as this person is. But what they actually found was that Orthodox participants more often recognized scrupulosity OCD and recommended psychological treatment than did the non-Orthodox. And so the question is, why? And the answer is pretty straightforward, where people who were in the Orthodox group were able to differentiate what's considered standard religious practice versus OCD. Someone who wasn't from that community probably labels everything as OCD-like, but that's just what that group of Jews do, right? And so they couldn't then become more nuanced and recognize, like, okay, this is just Orthodox Judaism, this is more OCD-like. And so the implications of the study are the importance of a nuanced understanding of the person's religion when you're treating them so that you could differentiate, OCD from non-OCD. So how do we differentiate religion versus OCD? But more specifically, how do we differentiate stringent religion versus OCD? Because even within an Orthodox group, an Orthodox community, there are those that take on extra stringencies or practice the religion in a more stringent or extreme way than others, and yet it's still not OCD. So how do we make that distinction? So there are a few questions to ask yourself. First is clearly excessive. Is this person's behavior clearly excessive compared to what everyone else is doing, right? Now, again, that each of these on their own is not going to give you the answer, but if you take it all together, you'll get a good feeling for it. So that's one question you want to ask yourself. Is this clearly excessive? Does this person's, approach consist of many doubts, what ifs, maybes? What if this isn't the proper, way to pray? Or maybe I didn't have full intention. I don't know for sure. I think I did, but maybe I didn't. Once someone comes with lots of maybes and what ifs, that's a very good telltale sign for OCD. Is it stemming from distress or devotion? Is the person's behavior, are they spending 4 hours picking out those 4 species for Sukkot, for that holiday? Is it because they are really into it? And just like someone might spend time on picking out a Rolex watch or fancy car, they're spending time with their religion, which could be considered a beautiful thing. Or is it because of I'm so nervous and I'm so scared that what if it's not the right one and it has to be, so I need to like spend hours on this, right? So is it being driven by devotion or from distress? Engaging in behavior counter to the true laws, right? Like prayer is a great example. Sometimes people are repeating the same words again and again. Often it's a word that other religious Jews would not be repeating, such as God's name, right? The idea of not saying God's name in vain. But because they're not 1,000% sure that they pronounced it correctly, they're repeating it again and again. So their behavior is actually counter to religious law. Or it could be negatively impacting other areas of religious life. What if they're spending so much time with prayer, then now they are not spending enough time with other rituals that people in the community are spending time with, or with their family, or with other areas of their life. So if they're spending a lot of time with one specific law within their religion, but then all the other laws they kind of forget about, that also tells you that it sounds more like OCD and not just general stringent religious practice. Only stringent regarding certain laws. That's kind of what I touched upon now. Like certain laws they're very strict about, other laws they don't care about. So that tells you that it's likely OCD. And a great question to ask someone with OCD is if a rabbi would say to you to do otherwise, not any rabbi, your rabbi, if he tells you like, don't be doing this, instead do that, right? Like only say Shema one time. That's like a paragraph in prayer. Someone with stringent religious practice would say, if my rabbi is telling me to do that, I want to follow my rabbi. That's like one of the approaches we take within the religion. Like, you ask your rabbi and whatever they tell you goes. Someone with OCD will be like, what if my rabbi didn't really understand what I said? I don't know. It's so hard. I can't, like this could be really bad. So that's another great question to ask. And excessive reassurance. So they're constantly asking for reassurance. They're asking the rabbi again and again, are you sure this was fine? I don't know. Are you positive? And they're going to their spouse and their friends, like, I did this. Is that okay? Like, if they're constantly going to other people to get reassurance, that's another. So these are great questions to ask to differentiate between stringent religion versus OCD. Okay, so let's discuss treatment for OCD as it relates to scrupulosity. So as we spoke about in the other video, the gold standard psychotherapeutic treatment is ERP, exposure and response prevention. And you can look at the other video to get more of the details of this. But in short, we're breaking the cycle by stopping the compulsions and by purposely triggering and exposing yourself to your fears again and again until eventually you learn to tolerate it better, and it usually tends to bother you less. So specific exposures for scrupulosity would be, for example, keep milk and meat near each other in the fridge, right? Or pray in an area where it's difficult to maintain concentration. There's lots of talking all around. Or purposely think about the possibility that, maybe I don't truly believe in God. Now, collaboration with a rabbi is really important because, again, you don't want to go against the person's actual values. So you want to collaborate with the rabbi to find out where is it crossing the line and where is it just getting a little bit closer to the line so the person can start tolerating their discomfort and learning how to deal with their OCD. So collaboration with the rabbi is really important when it comes to OCD treatment. That being said, there are still some obstacles and solutions, fortunately, in treating scrupulosity. And one is differentiating OCD symptoms from normal religious practice. How do I know what's OCD and what's normal religion? And so for that, we spoke earlier about the differentiating questions you can ask to figure that out. Oftentimes, there's poor insight among patients with scrupulosity. And so it's harder for them to recognize it as OCD. And so one way you can help with that is by bringing attention to how OCD is actually interfering with their genuine religious practice, as we discussed earlier. And that could help them with the insight to recognize, like, okay, this is OCD. Another obstacle could be that exposures, sometimes could violate the actual law, so you need to make sure that it doesn't. And for that, consult with a rabbi. You want to find the right rabbi. You want to usually work with a person's rabbi so that they take their word, but sometimes you have to speak with the rabbi ahead of time to explain to them what OCD is and the purpose behind the treatment so that they get a full understanding. Consultation with the patient's religious figures who may not get OCD, that could be an issue that you come up with, like I just mentioned, right? Like if they don't understand OCD, they may be like, no, this is great what this person's doing. They're being extra careful with the religion. What's wrong with that? And so for that, you want to provide psychoeducation to the religious figure and explain to them what's going on. Patients reassurance seeking from rabbis. This is very common where the patient will constantly call the rabbi and say, I know you told me to listen to my therapist and do exposures, but even this exposure and even in this way, and what if this and what if that? So that could be a problem that comes up. And so you want to implement rules for when reaching out is okay and when not. And you want to come with pre-negotiated responses that the rabbi can tell the patient, like, we already agreed on that answer to that question. Not that it's going to hurt the relationship, so it's pre-negotiated that it's okay to do this, but you don't want the rabbi constantly providing that reassurance. And also, the patient should accept personal responsibility if any sins are committed, because if the deal is that the rabbi is going to accept all personal responsibility, you're kind of avoiding the core of fear, which is that that the patient themselves is responsible for engaging in sin. So that's something you want to keep in mind as well. And then last, the rabbi's approval of therapy or exposures can itself be reassuring, because you can say, the patient can say, if my rabbi says it's okay, so that's not a sin anymore, so it's fine. So you kind of got around the issue, except until the next trigger comes up. So this could be a complicated one. And what I recommend is that therapists should not inform the patient whether the rabbi was consulted and exactly what was said, but instead have this general rule, like me and the rabbi are touching base every now and then, and keep it kind of vague without giving that extra reassurance each time that your rabbi said this is okay, because if you do, it could defeat the whole purpose of the exposure. Some Jewish sources against obsessive practice: the Torah was not given to heavenly angels, lo nitna Torah l'melech yasharis, which is from the Talmud, from the Gemara Brachos, or her ways are pleasant ways, and all her paths are shalom, peace, and so, which is from Proverbs. And so these are just some general ideas to keep in mind, that the whole religion was not meant to be this massive burden on someone, right? I actually heard a really interesting story where there was this kid who was waiting for his grandfather many years ago to arrive by train, and the grandfather finally came, and the grandfather asked the kid, can you get my luggage from the back of the train, from the back car? Kid said sure. And as the kid's coming, the grandfather sees the kid carrying this luggage, and he goes like, no, 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 it's the wrong one, it's the wrong one. Finally, when the kid came close by, he asked the grandfather, how did you know it was the wrong one? I was so far away, you couldn't even tell what the luggage was. And the grandfather answered, because I saw you schlepping it. I saw you like having a really hard time carrying it, like super heavy, and mine wasn't that heavy. And this is like a metaphor for the idea of how, if religion is becoming this massive burden in someone's life, something's up, because that's not the intention of what that religion is supposed to be doing. So in short, OCD comes in many colors, but the fundamentals are the same. Religious OCD is just one of those flavors, one of those colors, and has its nuances. And so, for example, you want to be able to differentiate religious OCD from standard religious practice and all the other, hurdles and nuances that we spoke about. Religion does not cause OCD, but it is a breeding ground for people who have OCD. Treatment for OCD is exposure and response prevention, although there are other treatments as well, which I've spoken about in the general OCD seminar a little bit, and I plan to speak more about in upcoming video seminars. And the treatment for scrupulosity and religious OCD is really the same, but collaboration with the rabbi is really important, and keeping in mind the different nuances that I mentioned. Hope you enjoyed this video seminar. To see a full list of our current videos as well as upcoming videos that we'll be posting soon, visit us at adopsychologycenter.com and sign up to be notified when we post new videos. Bye for now.